Pass your exam with mental health relapse prevention practice. Question 1. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A. Restating. Option B. Encouraging description of perception. Option C. Summarizing. Option D. Asking why questions. The correct answer is option D. Asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication, as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot. Question 2. In treating a patient with generalized anxiety disorder, GAD, using cognitive behavioral therapy, CBT, what is the most appropriate goal of this therapy? Option A. To explore the patient's childhood experiences. Option B. To reduce the patient's symptoms through medication. Option C. To change the patient's negative thought patterns. Option D. To improve the patient's social skills. The correct answer is option C. To change the patient's negative thought patterns. The most appropriate goal of cognitive behavioral therapy CBT in treating generalized anxiety disorder GAD is to change the patient's negative thought patterns. This therapy focuses on identifying and modifying. Question 3. Which chronic medical condition commonly triggers major depressive disorder? Option A. Pain. Option B. Hypertension. Option C. Hypothyroidism. Option D. Crohn's disease. The correct answer is option A. Pain. Chronic medical conditions can significantly impact mental health, often serving as triggers for major depressive disorder MDD. The correct answer is a pain, as chronic pain is one of the most well-documented. Question 4. What principle about patient-nurse communication should guide a nurse's fear of saying the wrong thing to a patient? Option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. Option B. Patients are more interested in conversing with you than in hearing your perspective, making offense unlikely. Option C. Considering the patient's background, the likelihood of the comment causing harm is minimal. Option D. Individuals with mental illness often possess a heightened capacity for forgiveness. The correct answer is option A. Patients tend to appreciate a well-meaning person who conveys genuine acceptance, respect, and concern for their situation. The correct answer is A. Patients value interactions with healthcare providers who express genuine acceptance, respect, and concern for their well-being. By focusing on conveying these qualities, a nurse can help. Question 5. Kyle, a patient with schizophrenia, began taking the first-generation antipsychotic haloperidol, Haldol, last week. One day you find him sitting very stiffly and not moving. He is diaphoretic, and when you ask if he is okay, he seems unable to respond verbally. His vital signs are BP 170/100, P 110, T 104.2 a degree F. What is the priority nursing intervention? Select one that does not apply. Option A. Hold his medication and contact his prescriber. Option B. Wipe him with a washcloth wet with cold water or alcohol. Option C. Administer a medication such as benztropine IM to correct this dystonic reaction. Option D. Reassure him that although there is no treatment for his tardive dyskinesia, it will pass. The correct answer is option C. Administer a medication such as benztropine IM to correct this dystonic reaction. The patient's symptoms, including stiffness, diaphoresis, inability to respond verbally, and vital sign abnormalities, are indicative of neuroleptic malignant syndrome NMS, a serious and potentially. Question 6. A male patient calls to tell the nurse that his monthly lithium level is 1.7 milliequivalent/L. Which nursing intervention will the nurse implement initially? Option A. Reinforce that the level is above the therapeutic range. Option B. Instruct the patient to hold the next dose of medication and contact the prescriber. Option C. Advise the patient to go to the hospital emergency room immediately. Option D. Inform the patient about the possibility of seizures and appropriate precautions. The correct answer is option B. Instruct the patient to hold the next dose of medication and contact the prescriber. A lithium level of 1.7 meql is above the therapeutic range, indicating a potential risk of toxicity. The initial nursing intervention should be to instruct the patient to hold the next dose of medication and. Question 7. In the care plan of a male patient diagnosed with a dissociative disorder, the nursing diagnosis of ineffective coping is included. Which behavior demonstrated by the patient supports this nursing diagnosis? Option A. Has no memory of the physical abuse he endured. Option B. Using both alcohol and marijuana. Option C. Often reports being unaware of surroundings. Option D. Reports feelings of not really being here. The correct answer is option B. Using both alcohol and marijuana. The correct answer is B because using substances like alcohol and marijuana can be a sign of ineffective coping mechanisms in patients with dissociative disorders. Substance abuse is often used as a maladaptive way. Question 8. How does emotional trauma typically affect individuals physically? Option A. Emotional trauma is a distinct category and unrelated to physical symptoms. Option B. Physical manifestations of emotional trauma are usually temporary. Option C. Emotional trauma is often manifested as physical symptoms. Option D. Patients are more aware of physical problems caused by trauma. The correct answer is option C. Emotional trauma is often manifested as physical symptoms. 1. Correct answer C. Emotional trauma is often manifested as physical symptoms. When individuals experience emotional trauma, such as severe stress, grief, or abuse, their bodies can respond physically. This. Question 9. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A. Exposure and response prevention. Option B. Dialectical behavior therapy. Option C. Family therapy. Option D. Interpersonal therapy. The correct answer is option A. Exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 10. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to: Option A. Engage in a quiet meditation. Option B. Ask simple questions even if the patient will not answer. Option C. Use the technique of making observations. Option D. Simply sit quietly and leave when the patient falls asleep. The correct answer is option C. Use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 11. Pablo is a homeless adult who has no family connection. Pablo passed out on the street, and emergency medical services took him to the hospital where he expresses a wish to die. The physician recognizes evidence of substance use problems and mental health issues and recommends inpatient treatment for Pablo. What is the rationale for this treatment choice? Select one that doesn't apply. Option A. Intermittent supervision is available in inpatient settings. Option B. He requires stabilization of multiple symptoms. Option C. How do you feel about talking to a mental health counselor? Option D. Medication adherence will be mandated. The correct answer is option D. Medication adherence will be mandated. The correct answer is D because medication adherence being mandated is not a primary rationale for inpatient treatment. The main reasons for recommending inpatient treatment in this scenario include the need for. Question 12. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of: Option A. The need to dominate others. Option B. Inventing traumatic events. Option C. A need to develop close relationships. Option D. A potential symptom of traumatization. The correct answer is option D. A potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 13. In what order should the following goals be approached for a client being treated for alcoholism? Option A. Learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C. Abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D. Abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B. Developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative. Question 14. Substance abuse is often present in individuals diagnosed with bipolar disorder. Laura, a 28-year-old with a bipolar disorder diagnosis, chooses to drink alcohol instead of taking her prescribed medications. The nurse caring for this patient recognizes that option A, anxiety may be present. Option B, alcohol ingestion is a form of self-medication. Option C, the patient is lacking a sufficient number of neurotransmitters. Option D, the patient is using alcohol as a coping mechanism. The correct answer is option B, alcohol ingestion is a form of self-medication. Individuals with bipolar disorder may turn to alcohol as a form of self-medication to cope with their symptoms. This behavior is often seen as an attempt to manage mood swings and alleviate distress. It is important. Question 15. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as option A, moderate, option B, severe, option C, mild, option D, non-existent. The correct answer is option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 16. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 17. A patient with panic disorder is prescribed a benzodiazepine. The nurse should educate the patient that this medication is typically used for option A, for long-term maintenance therapy, option B, as a first-line treatment, option C, for short-term use due to the risk of dependence, option D, to treat depression symptoms. The correct answer is option C, for short-term use due to the risk of dependence. The correct answer is C, for short-term use due to the risk of dependence. Benzodiazepines are usually prescribed for short-term relief of anxiety symptoms due to the risk of dependence. Prolonged use can lead to. Question 18. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be option A, Nursing Interventions Classification, NIC. Option B, Nursing Outcomes Classification, NOC. Option C, NANDI Nursing Diagnoses. Option D, DSM-5. The correct answer is option D, DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 19. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 20. During an admission assessment and interview, which channels of information communication should the nurse be monitoring? Select one that doesn't apply. Option A, auditory. Option B, visual. Option C, written. Option D, tactile. The correct answer is option C, written. During an admission assessment and interview, the nurse must actively engage with and monitor multiple communication channels to gather comprehensive patient information. The correct answer is C, written, as it. Question 21. During a treatment team meeting, the point is made that a client with schizophrenia has recovered from the acute psychosis but continues to demonstrate apathy, volition, and blunted affect. The nurse who relates these symptoms to serotonin excess will suggest that the client receive option A, chlorpromazine, option B, phenelzyme, Option C. Haloperidol. Option D. Olanzapine. The correct answer is option D. Olanzapine. In this scenario, the symptoms of apathy, volition, and blunted affect are indicative of negative symptoms commonly seen in schizophrenia. These symptoms are often associated with dopamine and serotonin imbalances. Question 22. Luke's family comes home one evening to find him extremely agitated, and they suspect he is in a full manic episode. The family calls emergency medical services. While one medic is talking with Luke and his family, the other medic is counting something on his desk. What is the medic most likely counting? Option A. Hypodermic needles. Option B. Fast food wrappers. Option C. Empty soda cans. Option D. Energy drink containers. The correct answer is option D. Energy drink containers. During a manic episode, individuals often exhibit symptoms such as hyperactivity, decreased need for sleep, and excessive involvement in activities that can have harmful consequences, such as overconsumption of. Question 23. Which drug group requires nursing assessment for the development of abnormal movement disorders in individuals taking therapeutic dosages? Option A. SSRIs. Option B. Antipsychotics. Option C. Benzodiazepines. Option D. Tricyclic antidepressants. The correct answer is option B. Antipsychotics. Antipsychotics choice B are the correct answer because they are strongly associated with the risk of extrapyramidal symptoms EPS and other movement disorders due to their dopamine receptor blockade in the. Question 24. A 33-year-old female diagnosed with bipolar I disorder has been functioning well on lithium for 11 months. At her most recent checkup, the psychiatric nurse practitioner states, "You are ready to enter the maintenance therapy stage, so at this time I am going to adjust your dosage by prescribing." Option A. A higher dosage. Option B. Once weekly dosing. Option C. A lower dosage. Option D. A different drug. The correct answer is option C. A lower dosage. Bipolar I disorder is a chronic condition requiring long-term management, and lithium remains a first-line mood stabilizer for both acute episodes and maintenance therapy. The key principle in maintenance therapy is. Question 25. Which statement demonstrates a well-structured attempt at limit setting? Option A. Hitting me when you are angry is unacceptable. Option B. I expect you to behave yourself during dinner. Option C. Come here, right now. Option D. Good boys don't bite. The correct answer is option A. Hitting me when you are angry is unacceptable. Choice A. Hitting me when you are angry is unacceptable demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear,